Hi friends, good evening. I'm Dr. Ashutosh Gupta, and today we are going to talk about multiple pregnancies. Okay, so meaning thereby that those multiple pregnancies usually they happen because of an IVF. Okay, so earlier in an IVF, what we used to do is a multiple embryo transfers, right? Okay, but we have identified that there is a lot of complications for those multiple embryos being transferred into the uterus. Some we can have multiple pregnancies in the uterus. Some embryos might even go to the cornua, and therefore we can have a cornal pregnancies, or we can have an ectopic pregnancies, and thus the come and thus the some element of fetal reduction comes into between, right? Okay, but now we usually what we are doing in an IVF is this a two embryo transfer. So meaning thereby that God forbid one of the embryos might get divided into two, and therefore we can have a triplets, but those triplets are PADC triplets, meaning thereby it is a dichorionic and triamniotic triplets. Today we are going to discuss about the quadruplets, right? So this is a normal spontaneous conception, no sort of an any drugs, nothing at all, no ovulation induction, and no IUIs, no stimulation, nothing at all, and it is a spontaneously conceived. And so this is a sort of an, so we are dealing with the quadruplets, right? Okay, so the uterus is not meant to have multiple pregnancies more than two, right? So first let us see the quadruplets, and then probably we'll see the management. So look carefully, we are seeing the first fetus, and then the second and the third. They are in a different chronicity, meaning thereby that they do have a different sex, all of them. So this is the second and the third. Then we are getting into the fourth one, and this is the fourth fetus. Now let us count them again. So this is the second and the third. So this is the third one, third fetus, and then we see the second one which is lying above it, and then this is the fourth one. Okay, fourth, third, second, and then in the last we'll get to the first one, right? And then and so there lies the first one. Okay, so we are dealing with the quadruplets, which are having a different chronicity, and what we can see is this is a 10 weeks ultrasound that we are doing, and astonishingly that probably we can do all the level one. We can see for the ductus, we can look around for the nuchal translucency, we can see the nasal bone, we can see for the limbs. The only issue that remains is a physiological gut herniation, right, which is normal up till 11 weeks and 6 days. Okay, so the physiological gut herniation gets reduced spontaneously by 11/6. If it doesn't, then probably we can call it as a gastroschisis. Okay, so that is how it is. So we can very well look around for the nasal bone, and then the cranium, and then the whole spine. We can see for the ductus venosus. So this is how the baby at 10 weeks look like. So all the four of them, they were like this only. Okay, so this is the second one. Okay, our uterus is meant only for a single pregnancy. Okay, this is the price that we have paid for an upright posture. As you add on one single, as you add on one more pregnancy, and then you deal with the twins, you have to reduce 3 weeks and 3 days. Okay, and then the weight also comes down drastically. So meaning thereby that single pregnancy can go up to 38 weeks of gestation, and something around 3 kgs is the weight that probably we can expect. As you add on one baby to it, so a twin pregnancy will get up to 35 weeks, and then 2.0 kgs or 1.9 or 2 kgs is the weight that we can expect. If you add on to another one, so probably if you talk about triplets, it would go to 31 weeks, and then the fetal weight would get drastically reduced to something around 900 grams to 1 kgs. Okay, so meaning thereby that for all practical purposes, twin pregnancies we can continue, but triplets or more than that, they are justifiable, medical, social, ethical. They are all indications of doing a multifetal pregnancy reductions. Since we are dealing with a different chronicity, so probably it was an ease for us that probably we can reduce the baby at ease, and so that this is the chronicity and the placenta are different, the blood supplies are different, so probably we can reduce the babies. And the second baby which is there in the another sac, it usually doesn't get affected. So we have used 26 gauge needle. This is a very fine needle, and then in one sort of a single prick, we had reduced two babies, and therefore she was left with DADC twins. From a quadruplets of different chronicity, we had reduced. So we had reduced at 12 weeks and 4 days, and I'm not showing the videos for that, but probably not today. Not today. We have not done at 10 weeks. So we have just put it out for something around 12 weeks and 4 days. By that time, we can really look around for the baby in a greater depth. We can look around for the heart. We can look over the TR. We can definitely have an idea about the kidneys. We can definitely have some idea about the whole spine and diaphragm, stomach, and all those stuff. So the reduction happens at something around 12 weeks and 4 days. And this quadruplets, in any of the circumstances, we really cannot continue with this quadruplet. So probably those reductions they need to be done. And then we have done it at about something around 12 weeks, 4 or 5 days, and then she was left with DAD sequence. Okay, thank you very much for your patience.